Hello, this is Dr. Stephen Harkins, and this is page 35 of Anatomy Coloring Book. The hip bone, pelvic girdle, and pelvis. What is known as the hip bone is actually called the pelvis, or the pelvic bone, or the os coxae. And it's actually kind of and it's actually three bones in one. And I'll outline them for you. First, we have the ilium. The ilium is this bone here. And developmentally, they started out as three separate bones and then they fused. This is the ilium. Here is the ischium. And lastly, oops, let's go right over here. There we go. That's the ischium. And the pubis, the pubic bone. And what you're looking at is the right ilium. So this is the posterior, and this is the anterior, or this is the back, and this is the front. So this is what you sit on. This is your bottom right here, right here. And here is the pelvis from the other side, from looking at it from the inside. If you were to take your pelvis right here and sort of rip it in half, this is one of them that we're looking at right here. This is the outside look at it from looking at it this way. And this up here is looking at it from the inside. So we've sort of ripped it out and ripped it in half. And here we have our ilium, our ischium, the bone you sit on, and the ilium, the bone that is in the front of the pelvis. Note the area where all three of these bones come together. This area is called the acetabulum. It is a deep socket, a deep concave socket where the hip bone, where the femur, the head of the femur rests in this area here. This hole right here is called the obturator foramen. The obturator foramen. So we have in review the largest of the hip bones, the ilium, the ischium, and the pubis. Also note on the front of the pubis here, there is, and I'll show you down here, the two pubic bones from the right and the left hip bone meet to form what's called the pubic symphysis, or the symphysis pubis. The right and left pelvic bones, or hip bones, combine together at this symphysis pubis to form what is the pelvic girdle. And it becomes sort of one unit. And inside this pelvic girdle rests the sacrum and the spine. The sacrum and the spine are not part of the pelvic girdle. But the weight from the spine and from your torso and upper body rests inside the pelvic girdle. And it's sort of a keystone type effect where the sacrum the sacrum here, also known as the tailbone, rests inside the pelvic girdle. Yeah, like a keystone, like sort of something triangular sitting, let's see, in some sort of squared off thing. Anyway, the weight goes down and it's supported by this sort of keystone from of the pelvic girdle. And you can see, the weight would be distributed this way, and the pelvic girdle would push back this way and support the spine upward. And again, the sacroiliac joint is this joint right here. Actually, we haven't talked about this yet, but this joint right here in between the sacrum and the two ilia is called the sacroiliac joint. The sacro, S-I, the sacroiliac joint. The sacroiliac joint, and it also known as the SI joint. The SI joint. Sacroiliac joint. Put all together, the pelvis, the sacrum, and each half of the pelvis, each side of the pelvis, plus the sacrum, or excuse me, the pelvic bones say A, and, or let's see, the left pelvic bone and the right pelvic bone, left and right, you put them together with the sacrum, and we call this the pelvis. This whole unit we call the pelvis. Recall, we call this the pelvic girdle without the sacrum. But the entire unit together with the sacrum we will call the pelvis. Now, the pelvis, there are some terms regarding the pelvis. The false pelvis is this whole area of the pelvis from the iliac crest, the top of the pelvis. And by the way, that's what this is called here, the iliac crest. From the iliac crest all the way down and into this sort of mid-pelvis area is called the false pelvis. The false pelvis. This area here on the right is called the true pelvis. The true pelvis. And this first area here is the top area is called the, right here is called the pelvic inlet. And this is a view from the side now, as if there was a slice, a sagittal slice, a cut sagittally through the pelvis. The pelvic inlet here and the pelvic outlet here, from the tip of the coccyx to the pubic symphysis here. So the false pelvis is known as the false pelvis because it is not bordered here on the front by any significant bone or muscle. Of course, the abdominal muscles are there, but it's not a true ring, so to speak, a true bony ring. So you can see the borders of the pelvis, the true pelvis here, the top of the sacrum and the bottom of the coccyx, all the way to the bottom of the pubis, pubic symphysis, and the top of the pubis. And let's go over some other areas of note in the pelvis. It's very important to know the little bumps and just little protrusions on the pelvis and any bone for that matter. Here again is the back of the pelvic bone, the posterior, and here's the anterior. And then here is the posterior of from the other side. Let's look at some of these. So let's start here. We have the articular surface of the sacroiliac joint. Notice it's sort of kidney bean shape here. This is, I'll show you the analog down here. This is the right bone. So that is the surface inside of here. It is the surface right in here articulating with the sacrum and creating the sacroiliac joint. So this is the articular surface of the sacroiliac joint. And this is, once again, this is the back and this is the front over here. From the back, another point, very prominent point, this is the dimple on the baby's bottom that you see. It's called the posterior superior iliac spine, also known as the PSIS. The PSIS, the posterior superior iliac spine. You can actually palpate this and feel it on the back of the pelvis. Now, moving more inferior is the posterior inferior iliac spine. This is not palpable. You cannot, it's too deep underneath, too much muscle. From behind here, here is the posterior superior iliac spine right here. And as I said, on the back, it's sort of the dimples you see on the back. Here is the, let's make that blue instead. The posterior superior iliac spine. The posterior inferior iliac spine. And moving back up, here is the greater sciatic notch. And then the ischial spine. We're deep inside. These are non-palpable, where there's too much muscle over these areas to really palpate them, to really feel them. That's what palpation is feeling. And here is the lesser sciatic notch here. And the ischial tuberosity here. This is what you sit on. Your ischium, your ischial tuberosity. Now on the front of the pelvis, you can also see these very prominent too. These bumps here on the front. These are the bones that you can feel on the front of your pelvis. The anterior superior iliac spine. And the iliac crest is this top ridge on the pelvis, which you can palpate. You can feel it right now, where the love handles are. It's the bone where you feel the love handles. Now moving on, the anterior inferior iliac spine. And moving down, of course, we have the acetabulum here, yes. This is the socket where the hip fits into, where the femur fits into, as you can see right here. Here is the superior pubic ramus, the pubic tubercle here, and the inferior pubic ramus. This area in this great massive area of the pelvic bone of the outer portion is called the ala, pelvic ala, or wings. It means the wing of the, because they thought it had a broad wing shape of the ilium. On the other side of the ilium, we have this is the inside, the iliac fossa. And here again, from a different view, is the ischial spine. Same as over here from a different view. We talked about the obturator foramen, the hole that's found in each pelvic bone. And there's a line running along the inside of the pelvis. It's a ridge or a bump, and it is called the arcuate line of the pelvis, or of the hip bone, of the pelvic bone. And it's important for its muscular attachments. And what it is, it really represents a sort of a twisting of the pelvis in the way it was shaped here. A slightly torqued ilium. It's like a twisted propeller blade, and the arcuate line is represents the stress point, so to speak, during the development of the twisting or torquing of the pelvic bone. And down here we see the ischial spine. We see the ischial tuberosity, which you sit on. We see the iliac crest. We see the anterior superior iliac spine. These are the bumps on the front of your hips that you can feel very easily. And again, the iliac crest is the love handle area, where when you put your hands on the sides of your hips, that's what you feel right there. The iliac crest. The ASIS, the anterior superior iliac spine. This is the back view here. Notice the posterior view of the acetabulum here, where the head of the femur rests. And this represents the end of page 35 of Anatomy Coloring Book. I'm Dr. Stephen Harkins.